Health reporter Haley Hernandez is joining me this morning. Haley, there's some trivia for us. What's the deadliest animal in the world?
Yeah, so the first thing that comes to your mind might be, lions, tigers, bears. Actually, it is a surprising answer for a lot of us. It is mosquitoes. The U.S. Centers for Disease Control and Prevention says mosquitoes kill more people than any other animal. A lot of that stems from their ability to spread diseases such as malaria, dengue fever, and West Nile. This week, the CDC issued an alert about locally acquired cases of malaria in Florida and in Texas, saying that all 5 patients are now being treated and are improving. And since this is the time of year that these insects do like to bite, we're going to bring in someone to answer all of your questions about malaria. Joining me now is Dr. Bonnie Word. Dr. Bonnie Word is the director of the Houston Travel Medicine Clinic. Dr. Word, good morning. I'm sure you're busy this time of year. What is it exactly that the CDC is warning us about? I mean, malaria really hasn't been on our minds in decades. So tell us, what are they trying to tell us?
Okay, I think first thing they're trying to tell us that it's a reminder that we're a rather international society these days, that people travel internationally, people will be exposed to diseases that are transmitted by mosquitoes and sometimes bring them home with them, and they become ill, as in the cases we have here. So the big thing is how to prevent yourself from being exposed to malaria and or bitten by a mosquito.
So the cases that they had locally, they said that they were not associated with travel. So does that mean that somebody else had it and now the mosquitoes had it? Like, do we know how that's transmitted?
And that's very common. Internationally, you'll have probably about a little more than 200,000 deaths with about 400 million cases of malaria. However, in the United States, we have about 2,000 cases every year. When you take a look at where do these people get it, they acquire it after international travel. They have destinations where malaria is present, and it's present in a lot of parts of the world, in Africa, in Asia, in South America and Central America. Not all parts, but there are pockets of it. In some areas, it can be very severe. So the patient comes back, or the traveler comes home, they may be infected, they may have sustained a mosquito bite, and lo and behold, about 14 days later, on average, they develop symptoms. We have a mosquito here that is capable of, if you bite them, they can get infected, and guess what? They bite the next person, and if that person has some parasites floating in their blood, then they're more likely to get infected. And that's probably what happened in this case.
And so what would the symptoms be like? If somebody were to have it, how would they know?
Typically are flu-like symptoms, headache, fever, myalgia, and depending on how the concentration of the parasites that you have, how severe it would be. Also, there are 5 different types of malaria that can cause infections. The one that the individuals had both in Texas and in Florida was a type by Vivax. That doesn't cause as severe an infection as, say, another one called falciparum. So that's, and the other thing about the type that these 2 individuals occurred, that once you get infected, those parasites sometimes like to go hide out in your liver. And usually you are treated with an additional course of medication because you could potentially relapse months or years later. And that may well be what have happened in these cases. Somebody may have relapsed.
So, but what can how can somebody tell if they were bitten by a bug like this versus a normal bug bite?
Well, you're not going to be able to tell. So your best thing is to prevent yourself from getting bitten by a mosquito. How do you do that? First thing is you're going to use EPA, or the Environmental Protection Agency. Go to their website, look at the mosquito repellents that they have approved, because they've determined that they're efficacious as well as safe, and just follow the directions on how to use it. The next thing is, that's just your personal body. The other thing you can do is you can actually buy products that go on clothes. The other products, initially, the mosquito repellents usually just go on exposed skin, not anywhere else, and it has to be exposed, intact skin. Another product is a category called permethrins. You can put that on clothes to help repel mosquitoes and ticks. Finally, the last thing you want to do, once you do that, look at your surrounding environment. keep windows closed, ideally, if you can. Have screens on windows. Freestanding water, that's where mosquitoes like to breed. And if you have no choice, some people have bird baths, some people have little pools out for children. At least empty them and clean them once a week.
Yep.
And I guess the other thing is, if you travel to a place, malaria is one disease, but there are multiple diseases that are transmitted by mosquitoes that people may be exposed to, but some are vaccine preventable, some are not. Malaria is one that you can take medication to help prevent acquiring that disease before you travel to the destination.
All right, Dr. Word, director of the Houston Travel Medicine Clinic, we appreciate you taking time to talk to us this morning. All good advice, and be sure you can go to click2houston.com/CNET7 for more.